Good morning everyone, and in this video I want to talk about cancer. And cancer is a big issue within PNG and the Pacific. um, it's increasing. There are more and more people dying prematurely of cancer of many kinds. The common ones are mouth cancer, breast cancer, cervical cancer, uterine cancer, ovarian cancer, liver cancer, prostate cancer, um, gastrointestinal cancer or bowel cancer, and of course the different forms of cancers of the blood. For example, leukemia, lymphoma, and different problems or different kinds of cancer that affects the bone marrow. So cancer is very broad. There are many types of cancer, many forms of cancer. Cancer can affect the skin, cancer can affect the eye, cancer can affect just about any organ in the body. Of course, the common ones that we encounter in our countries is breast cancer in women, cervical cancer in women, uterine cancer, ovarian cancer, and in men, which we often forget. And I want to emphasize this point that we forget about cancers in men. Prostate cancer is a very common cancer in men. Bowel cancer or intestinal cancer or large intestine cancer, stomach cancer, and liver cancer. These forms of cancer, these four forms of cancer that I described or mentioned, are very common in men. So, me plus I think or mama, and I fully support that. But in this video, like highlighting that we also need to think of our fathers, our uncles, our brothers. They also suffer from cancer silently, and let's include them. And if you are a man age 40 and above watching this video, I want to encourage you to once a year go for cancer screening. Suppose you man block like boy na sumuk, you must go check your mouth cancer like the lips, the tongue, and the cheek. I'm just start lo cheek inside, and then on the tongue and on the gums. It will start like a small ulcer or small blister. Then it will grow and become red, and by the time it persists for more than 3-4 months, you go and check. Doctor might say, hey, look, it might be cancer. Let's do a biopsy and get it checked. And then you might find that it's cancer and end up doing big, surgery, cutting piece of the tongue or mouth out. But remember, by the time they cut the face, the cancer has already spread to the neck and to the lymph nodes, those small glands that appear, and it's there. It's not a cure. It may give you 5 years, 6 years, but eventually it's gonna come back, and doctors may find that it's growing in the liver somewhere. It has spread to the bones, to the intestine, and eventually it's too late. And these are affecting young men, young women, and I think most of these things can be prevented. And I always advocate for prevention, early detection. Our country is doing a lot to try and diagnose and treat, but as people too, we need to take care of our health. We need to take control of our health. Especially in PNG, Solomon Islands, and I think it's also extending to Fiji, the habit of betel nut chewing. It's also very common in Micronesia, Palau, Marshalls. Betel nut is a recognized cause of mouth cancer, so that's something that really we need to look at. And if you're watching and if you chew betel nut, likely you enjoy smoke, but at some point make it a point to go go get a checkup, have your teeth cleaned, and get it checked. And perhaps think about reducing the number of nuts you chew. So back to what I was talking about, those common cancers in women, young women, women after the age of 40, and men, especially us, after the age of 40. We talk about prostate cancer. And I want to talk a little bit more about prostate cancer and bowel cancer, because these two cancers are common in men after the age of 40, and we don't think about it. As fathers, we don't think about it. We don't, think about our health. We think of our families and our children. We work and try and provide for them, and we don't make the time to go and check. If you're a dad or men 40 plus watching, I encourage you to once a year go get your prostate checked. It's usually in a form of a blood test to screen for prostate cancer. The test is called PSA, prostate specific antigen, and that's a screening test. If the levels are up, then the doctors would advise further testing, for example doing an ultrasound scan or doing a small biopsy, getting a piece of the tissue of the prostate and check it under the microscope. The next one is intestinal cancer or bowel cancer. That's the second most common cancer affecting men. And we can do a common screening test where you will give a small stool sample, and then we will check for blood inside. If it is positive for blood, the doctors would advise you to go and do a colonoscopy to check for any growth or anything that is there that might resemble a cancer that's starting, and then doctors can do a biopsy or burn it out. And one more thing that I want to include, which I forgot, is liver cancer. So liver cancer is one of those very common cancers in men in Papua New Guinea, maybe in other Pacific Island countries too. I think in Micronesia too, it's very common. Liver cancer. And the main cause is hepatitis infection, hepatitis B, hepatitis C. These infections are very common in unhygienic conditions, so drinking contaminated water or food or unprotected sexual intercourse. This can transmit hepatitis B and C, and in the long run lead to liver cancer. I must also add that chronic alcohol use, drinking beer and alcohol for a long time can in the process damage the liver and at the end cause liver cancer. So again, for men, prostate cancer, bowel cancer, and liver cancer. Liver cancer we can screen by doing some liver test, doing ultrasound scan test, but most importantly we want to prevent getting hepatitis B and C infection. We can also test to check those two viruses, and if those two viruses, hepatitis B and hepatitis C, if they are causing infection in the liver, and there are treatment available to treat those two infections. So when we talk about cancer, we want to really start from the beginning, how cancer starts, what causes it, how we can prevent it, and the treatment part of cancer comes very, very late, way down. In public health, this concept of upstream and downstream, we talk about that. Think of a river, upstream, downstream. At Lawara na Lake Lawara. So upstream is things that happen before they come to the hospital. And by the time someone is at the hospital and sick with cancer, that's already in the downstream now. That's where you are doing surgery and chemotherapy and radiotherapy and all of this. But remember, the process starts upstream. Problems start like Lawara yet now come down. So by the time it reaches you like downstream, well, we have to go back to the source of the problem upstream. Go let Lawara na straight. So we talk about upstream and downstream. So I'm talking more of upstream, what occurs upstream and what we can do upstream to prevent or to stop or to minimize cancer from affecting our people. So, trying to fix a health system overnight can be very challenging. It's slow, takes money, but as individuals, we can change our lives today. Like today, you make a decision, you can make it happen. I'm going to eat healthy, eat nutritional food, minimize or start to reducing alcohol and beer, stop smoking or start to reduce smoking, stop chewing betel nut or start to reduce betel nut chewing. I used to drink alcohol. I used to take alcohol in medical school in my young life. But at some point, I decided that I'm going to stop. I have young families, and I need to think about their future. I need to be healthy so I can work and earn money and support my family and make sure that they finish their education and they established themselves as young adults. So these are the thoughts that made me realize that at some point I need to change my habits and focus more on my well-being, so that I can work and earn and continue to look after my family. That's us fathers we need to do, uncles, brothers who are watching. That's what we need to do. Think about what we need to do, and so that we continue to contribute to look after our families and our communities. So I want to emphasize and just encourage, if you're watching, spread, discuss this with your friends, families, and the more people are talking about it, the more people are discussing it about prevention and how we can live healthy and into our senior elderly years, the better. Yes, everyone will die at some point. All of us will die at some point. Some families have died. Just recently, one of our founding fathers of the country, Sir Julius Chan, passed away. 85 years of age. He lived a well and fulfilled life. Well, fruitful, productive life into his yesteryears. And that's what we need to think about. Live long, being healthy, so that we can contribute to our family and to our society. So thank you for watching. Yeah, there's more I can say, but I'll stop for now. But yeah, thank you.